Good morning, students. Today, I'm just continuing my second class for diploma students for the exit exam, which we have already discussed in the last first class. I told you I will go for the next subject with 100 questions. So like that we can improve minimum 500 questions for a subject. So this is today I have taken Pharmaceutics. You know very well the tentative program is given by Pharmacy Council of India in 5th and 6th October of this year 2024. So if you are listening to this class, I would like to request my viewers kindly to subscribe to my channel Pick Pharma DXP at DX Prasad in YouTube, and also you can get many other classes in pharmacy also. It is possible for you to listen. Today Pharmaceutics I have taken, this is the order which is given by PCI, Pharmaceutics MCQ, which I have taken some of the things detail which I have given. In every question is better to know about why this answer, why we want to select this answer in this MCQ. So that makes the student, if they are asking in a different manner or a changed question also, they can answer. Which one is not the mechanism of size separation? So you know there are many methods which you might have studied in pharmaceutics unit operation: size reduction, size separation. This all you might have studied. Size separation means you are separating the compounds by means of size. We can separate them by separation. You might have studied filtration, decoction, many methods. Size reduction you might have studied. After size reduction, size separation. Size reduction you might have done by cutting, compression, impact, attrition. So you might have studied many instrument also for cutting, simply blade or knife, compression by roller mill, impact by means of ball mill, attrition, both the principle will work it in ball mill, even by cyclone mill. Like that you might have studied. Anyhow, this all you have to revise if they ask question. Here the question is, which one is not mechanism of size separation? So we will take first one, agitation. So by pedal, baffles, they all used to separate the mixture of compounds by even agitating in a sieve, keeping the material in a sieve, and you can agitate and you can separate the material. So it's having some impact in that. And brushing in a sieve, keeping the material, using a brush over it, so that facilitate the separating the size of material which is already size reduced. So it's also a mechanism of size separation. Centrifugation you might have studied. Centrifugation, rotating RPM by means of centrifugal machine. So in which you also might have seen that the size separation mechanism. Compression. When you talk about compression, it is the mechanism of size reduction, not size separation. The instrument also, they might have given the example when you are studying the roller mill, which will compress the material and made into size reduction, and the area of the molecules will be increased. Size reduction you might have seen why we want to do size reduction, by increasing the surface area of the substance, and the absorption, distribution, all this, and solubility can also be increased. So that's the main thing. So in this question the answer is compression. Why? Because compression is not size separation mechanism. It is a size reduction mechanism. The next one is, you can see the compression picture I have shown and centrifugation picture I have shown. Brushing simply I have shown to keep in the sieve, and agitation I have shown the pedal, but this is just a mixing pedal. It's not connected with this agitation. Agitation I should have shown with the sieve, which can be agitated and improve the separation. So they all are separation technique. That's the question meaning inside. So when you are, excuse me, so next question, the Samhita. The dash Samhita includes reference of drug of animal, plants and mineral origin used until the first century after the death of Christ. So you say this is a chronology, the history which we have to remember. So Samhita means, I have shown, even they have given a choice of Ebers, Charaka, Hippocrates and Sushruta. Sushruta is the answer. Why? The Sushruta is a great historical importance because it includes historical unique chapter described surgery in Ayurveda, surgery training, instruments and procedure which still followed by modern science of surgery. It was originated in India. That's why that Sushruta Samhita, you have to remember. And you can see Hippocrates, we know that he is considered to be the father of modern medicine. And Charaka Muni or Agnivesha, his name Agnivesha, was the ancient Indian physician and a scholar who made the significant contribution to the first aid, field of Ayurveda. And Ebers Papyrus, you know very well, it's the first prescription in the tomb of Egyptian tomb. It is written there. The prescription. Prescription means it is a note which is written by a physician to the pharmacist for preparing the medicine. Previously it was written a formula for any disease, how to prepare a medicine, how to collect the herbals or collect the natural compounds, herbs, animal or mineral, and how to be mixed and how to formulate. That prescription is the first prescription, which is called papyrus, which is written in tombs of Egypt. So the student have to read the first slide, 2 questions only. Lot of informations I have given. So this will ring in your ears and you can answer the question if they ask in different form also. So the third question is cyclone separator, which you might have studied in your diploma in pharmaceutics. Cyclone separator, which separates the reduced or size reduction made powder, which can be separated. Cyclone separator, by means of blowing the air, works on the principle of, what is the principle? Whether it is centrifugation, it's true, because the air, the turbulent air inlet which enters and it makes a cyclone. The word cyclone is given because it works in principle of centrifugation. Agitation means like this, the shaking, no. Vibration, no. Gyration, just movement, this movement, gyration, no. Like this, a rotating but not in an oval shape and in an opposite gyration for solubilizing use. So cyclone separator is an instrument which work in the principle of centrifugation. And here the picture which I have shown is ball mill. You can see this is 3 rounds which I have shown is cascading, the word cascading. Ball mill will get the size reduction. It is working under 2 principles of size reduction. You might have studied 4 size reduction principle. This is also I am just giving you again repeatedly: cutting, compression, impact, attrition. This is the 4 principle for size reduction. In that, this ball mill will operate in the 2 principles. One is impact and another is attrition. Impact means something which is thrown on the object and breaking it into smaller particles. So here the balls will be thrown to the walls or to the objects and the object will be broken, that is impact. Or the object will be thrown to the walls and they will be broken, that is also impact. Attrition means when the balls when they are rotating, they make one to be a friction. In between the object will be powdered or the size will be reduced. So that will be attrition. So if you want to get this type of both the principle properly to be done, the ball should be fall to the top of the round ball mill and to be fall directly to the object. If you are having fast rotation, the speed of the ball mill is very high. The balls cannot fall and they cannot operate in the impact or the attrition method. It cannot break because it will be rotating in the walls of the chamber. The fast also cannot work. Very slow means the ball will not be lifted in the cylinder. It will be just down. So no size reduction will occur. So we need a medium speed, 2/3 speed, where the balls will be carried into the top of the cylinder, falls on the object and the size reduction will take place. So that's called cascading. You can see A, B, C in the picture. The B is the correct one, where the speed is medium. 2/3 speed will help for the proper size reduction. So the question is, they have asked efficiency. That means how a ball mill having an efficiency is maximum at what? How? Speed. So the answer already we know, I have explained. The speed should be the medium and 2/3. High speed, no efficiency, you will not get the maximum efficiency. Low speed, the balls cannot lift it up, it will be in the bottom, no size reduction. But if you are having 2/3 speed, the medium speed, the balls will be lifted and it will act in the main principle of the impact and attrition will take place by the ball. There will be smaller balls, bigger balls will also be there in the ball mill, so that you will get very good, amazing type of result in size reduction by this ball mill instrument. Very high speed, no chance of getting an effect because balls will be thrown out. It will be rotating along with the cylinder. The third C, picture C, high speed or very high speed, no use. Low speed, the A or the first picture, it will be only the balls will be in the bottom. But the B, 2/3 of the speed will help for getting very good result in ball mill. The fifth question, which mill depends on the principle of combining impact and attrition? Just now I told you attrition and impact. Listen again and again. Impact means throwing the object to the wall and breaking wall of the instrument and breaking it, or you can use a hammer or an object can be hit by means of another object, breaking it. That is called impact. Attrition means by friction, just going and doing like this. So this will work in ball mill. Not only ball mill, there are many other instruments also there. They have given first choice, it's a ball mill. Student can write it is 100% ball mill because there may not be two answers. Hammer mill, It will work only in impact, because hammer mill, hammering on object, impact only, no attrition. Roller mill, compression. Two rollers are compressing. So compression is the principle behind. Disintegrator mill, it is also not working in impact and attrition. Disintegrator, which will be rotating with a blade, which is used by means of attrition and as well as disintegrating, small cutting method. So cutting, compression, impact, these all the principle, four principle, don't forget, you have to remember. Size reduction, cutting, compression, impact, attrition. So their question is, which mill work with impact and attrition? That is ball mill. Size reduction is also known as size reduction. Your teacher might have told there are many words are there. Even communicating also one word. Communication. Also it is also known as communication. Size reduction is also known as communication. And also another name is diminution, is also in English, it is also size reduction only. So two answers are almost nearing to the size reduction. Pulverization is also reducing the size. Pulverization. So all the above, they are given a choice. The answer is all the above. So students should remember, size reduction can be called, in other words, the name is comminution, diminution, pulverization. So it is, answer is all the above. You see, seventh question is reduction, that is size reduction in particle size, or reduction in particle size means what will happen. This also in the first question itself, first slide when I was explaining itself, I told when size reduction is happening, immediately you can see the picture itself, the bigger one, surface area broken into smaller pieces, and size reduction, 5-4 pieces, the surface area will increase automatically. So that is, the answer is increase surface area is the correct one. Decrease surface area is wrong. Decrease the rate of absorption is wrong, because we know that size reduction we are making for increasing the absorption, increasing the solubility and increasing the distribution of the drug in our stomach or any purpose. It's very simple, for any student can understand. So the answer is increase surface area. Decrease in site of action for the solvent is also wrong, because we know size reduction makes the drug to increase the solubility and increase the absorption, because increase the surface area, easily soluble, and so that it cannot even it cannot, by reducing the size, it cannot decrease the site of action of the solvent. So you can see size reduction will increase the surface area is the correct answer. Hammer mill works on the principle of, this also student hammer mill picture I have given. The hammers are rotating, which is slightly having a movement in this way. So it will hit the object. So something, when we are hitting the object or the object is thrown to the wall, it is called impact. So we have 4 principles, don't forget: cutting, compression, and impact, attraction. So this will work in impact. So impact, they have given a choice. The answer is impact. The choice they have given attraction. Here there is not working in attraction. There is no compression like roller mill. There is no cutting like cutter mill. So the definition you can see. So the 9th question, we are coming to the 9th question. They came to the next question, fluidized bed dryer, which is very commonly used in the tablet manufacturing. Fluidized bed dryer has an advantage of, you know very well, it is used for tablet manufacturing. They are given a choice of attrition is not absorbed. attrition is not absorbed. That means fluidized bed dryer has an advantage of attrition is not absorbed. I think it is not connected with an advantage of fluidized bed dryer. Entire material is continuously exposed to the heat source because fluidized bed dryer is used to dry the granules and to maintain the humidity. The moisture present in them for the compression. So that will be calculated. It should not be very fluffy and it should be having the binder in proper way to get compression. So the entire material is completely exposed to the heat source. There is the heat, air will be blown. You can see the picture. From the bottom the air will be blown, that is the fluid, where the granules will be kept and it will be thrown to the bags which is present in the fluidized bed dryer. The fines will be collected by the bags, and once the drying, the moisture content is analyzed and it is giving, then it will be taken for compression area. So the answer is entire material is continuously exposed to the heat source. They are given a choice. Fluffy mast is formed. It is wrong. Fluffy means compression will be very difficult. Our main aim is for fluidized bed dryer is to dry the granules before compression for a tablet manufacturing. So students should remember fluidized bed dryer has an advantage if they give, or its duty is to have an dry the granules for before compression for tablets. So entire material is continuously exposed to the heat source. Fluffy material mass is formed is not the answer. Humidity can be increased. Totally wrong. Humidity we cannot increase. That means increase moisture. Why you want to increase? Become a damp mass. You cannot compress into tablet. So the answer is correct. Entire material is continuously exposed to heat source. Very clearly you can write. There is a definition which I have given because the question is 10. Which one of the following dryer is also known as lyophilizer? So lyophilizer means what? Lyophilizer. Yes. So definition for lyophilization. Students should know what is the word lyophilization. So lyophilization, a method of drying food or blood, plasma or pharmaceutical products or tissue without destroying their physical structure. Material is frozen and then warmed in a vacuum so that ice sublimes, and synonym freeze drying or lipophilization. So lipophilization, not lipophilization. Lyophilization, sorry, lipid is not coming here the word. Lyophilization is like sublimation. Students should remember sublimation means always they will say ice, when you keep there is vapors are directly solid to gas. So that can be used, even the liquid can be removed in the form of gas even when you are freeze drying. Freezing, it is possible drying can be taken. So that freeze drying is the method, otherwise it is called as lyophilizer, freeze dryer, lyophilization, sublimation, removing of the liquid or removal of moisture using freeze dry. That you should remember. And 11th question, how the liquid gets separated in freeze drying. Very interesting. Students, once if they come to continuously listening to the class, it's like a revision for your whole pharmaceutics, what you studied in these 2 years of Pharm, Pharm course. It will revise your knowledge and you will remember, it will be applicable for your use in the practice. So it's a very interesting, actually the very interesting course in the pharmacy is Pharm, where you are studying almost all details of manufacturing, dispensing, clinical pharmacy and hospital pharmacy. All these things you are studying, and a person can have a very good knowledge and he will be trained for going for the next steps in the pharmacy profession. So 11th question, how the liquid gets separated in freeze drying. Just now we discussed about freeze drying. So freeze drying, I told about the sublimation to remember, and also directly from the solid the gas can be removed in the form of the volatility can be seen there. So you can see they are boiling, no. Distillation, no. Freezing and crystallization, it's true. Freezing and crystallization in other chemicals, it is possible. That is the separation. The liquid gets separated from the solid by means of freezing and crystallization. Evaporation, you need heating, no. It is only can be done by means of liquid can be evaporated by their boiling points. But here by their freezing points and their crystallization point, it is possible for to separate. So freeze drying, the liquid gets separated in the principle of freezing and crystallization. And silver sun mixture is used for preparation of. What is this silver sun mixture? That is a picture which I have given. See the picture. This is the picture of the instrument silver sun mixer. Silver sun mixer looks like a pedal which will rotate in such a way. Even colloidal mill you might have seen it, but that will be pressed. Here by means of its rotating speed of the blade and the pedal, it can even make emulsions. Two immiscible liquids can be made into miscible by using emulsifying agent, which can reduce the surface tension between the two immiscible liquid. So they have asked the silver sun, you remember the picture and the name. Silver sun mixture, there are planetary mixture, there are baffles mixture, there are rotary mixture, there are many mixers are there, drum mixers, tunnel mixers. So but here this is silver sun mixture, which is specially used for preparation of, is it elixir? No, elixir is an alcoholic, hydroalcoholic preparation. Emulsion is too immiscible liquid, it needs some pressure or it needs some active action of an instrument. So that is done by silver sun mixture. Mouthwash, aqueous phase, it's a solution, not needed this instrument. And syrup, just solubilizing. There are many magnetic stirrer, mechanical stirrer can be used. But silver sun mixture is used for preparation of emulsion. So now we will come to the 9th question. Fluidized bed dryer, that we have seen, sorry. 11th question, 12th we finished. 13th question, filter aid which can aid the filtration, increase the filtration, are mainly used when liquid is required as a product. What is the question? Filter aids are mainly used when liquid is required as a product, first choice. Filter medium not available. Solid and liquid are required as product. Solids are required as product. You see, this question was somewhat very simple and little confusing. But when you filter means, you should think about what is filtration. Filtration means there will be, normally in the lab what you are doing you can remember, filter paper and the funnel and a conical flask. When you keep, filter paper is filter medium and the funnel and the collecting liquid is called filtrate, and the residue which is there, the solids which is there in the after filtration in the filter paper, you can say residue, that is a solid mean. So sometimes you will use the residue, sometimes you will use the filtrate. So all the first one, liquid is required as a product, is just a procedure for the filter. It is not that time it is not necessary for you to use a filter aid. Filter medium is not available. Suppose if you are not having filter medium or the medium filter paper is not working properly, then you need some filter aids. Sometimes some powder which will increase the filtration, separation of solids and liquids. Sometimes even enhance the filtration. So, answer should be properly, you should think. Even liquid is required as a product in a filtration. Everybody knows. Solid or liquid can be required for as a product, as I told now. Solid is required as a product. So, the answer is filter medium. When not available in the filtration process, you need a filter aid. And you can see filtration is a wide use to remove impurities, tend to log and filter medium. So the student should know there is some example of filter medium apart from the filter paper or anything like that. You can see diatomous earth and pertil and silica based materials are used as a filtration medium. There are several other special materials used for filter aids, including asbestos, cellulose, agriculture fibers, sawdust, rice, hull, ash, paper fibers. These all can be used as a filter medium or filter aid. So suppose you should have an idea what is this filter aid, what is the relation between the filter paper and why I told this is the answer B. Filter medium, if it is not available, then you have to go for filter aid. You can use, if medium means, just I am telling the example what you in the lab. If there is no filter paper, you can use asbestos, you can use cellulose, you can use agriculture fiber as a filter aid for filtration process. Finished. So you should remember that. You can see the picture also very simply, that is flow direction, septum, filter cake sometimes formation. So that will also sometimes block the filtration. So that time you can use some filter aid which can support. So next question, filtration you have to remember. 14th question, which one of the following is not a mechanism of filtration? Now the question is, you have to see all the answer. Which one is not the mechanism of filtration? See, they have given entanglement, impact. Impact, you know that it is not filtration, it is size reduction. But other things also you should understand. What is entanglement? See the picture I have given. Entanglement means the filter, this is enlarged, a filter paper is enlarged, just think about that. The filter paper, small filter paper is enlarged into 800,000 times it is enlarged, and you are seeing the parts of the small holes, small pores in the filter paper. So you see fibers which is present in the filter medium, when the liquid is passing through, the solid materials are stopped by the fibers, and there is a triangle shape first, and sometimes there is a round shape also, that is training, which will block, make cakes, and impugment a triangles, because the filtration when it comes flow slowly making a triangle shape black color, that is called that is impugment. And there will be dots or spots will be formed even in the fiber, that is entanglement. Entanglement will also sometimes will happen. So entanglement, impingement, straining, these all of them are filtration mechanism. Impact is not filtration mechanism. We have discussed what is that principle. Impact means it comes in size reduction. It is a mechanism of size reduction, and it is a principle of hammer mill. Like that you should remember, understand. You should recall the answers, then it will be very much easy for you to answer when you are preparing in another questions. When you are doing some questions, you will remember. 15th question, the efficacy of filtration increases if. They are asking, how can you can increase the efficacy of filtration? You asked, how come you can increase the efficacy of ball mill? There you told the speed should be 2 by 3, like that they are asking. How can you can increase the efficacy of filtration? They are given the choice. Compressibility of the solid is high. Is there compressibility of the solid is high? the efficacy of filtration will increase? No. Compressibility of the solids, it cannot. When you compress, squeeze the solid or the residue, some juice may come, but the filtration efficacy may not be increased. It cannot be compressed by means of simply when you think by hand, but large scale, we cannot say compressibility of the solids is high. We cannot say that is the efficacy of filtration increased. Filtration aid is added to the slurry. Suppose when you are going to filtrate, if you filtration aid bentonite, like you are studying bentonite, kaolin or activated charcoal, which shown here is just for another example, filter aid. But we have just now seen even like asbestos, cellulose, they are also filter aid which will help. And these filter aids will support them for filtration, even though filter cake is formed. Filter medium is used. Efficacy, that is any medium can be used. It cannot increase the efficacy of the filtration can be increased. Size, distribution of the solid, wide in slurry. If size distribution is wide, like small, big, if there is more, your teacher might have told, if there is small, big, they will make a network like a flocculation, and it will block the filtration. So it cannot increase the efficacy. Only filter aid is added to the slurry means it increase. So that is the answer. And the 16th question, which one of the following is not an example of filter aid? This is which one is not filter aid, they are asking. So we know activated charcoal having absorbing capacity, reversible. So it is an filter aid. Bentonite clay is also a filter aid. Kaolin is also a filter aid. But talc is not a filter aid. Talc is a dusting powder. It cannot absorb, it cannot reversible phenomena. It is just to block the filtration. So talc, you can say it is not a filter aid. Remember this. And now the 17th question. The slurry is, they are asking what is a slurry before filtration. You see, they are shown in the filtration, slurry is poured for the filter medium. There is a sand is kept instead of filter paper. You will get the filtration. So a suspension to be filtered is called the slurry. A porous membrane used for retaining the solid, that is filter medium. A clear solution which you seen down, that is filtrate. None of the above is not the answer. The suspension or the slurry, that is called slurry, which is needed for filtration, which is poured from the top, that is called filtration. What do you mean by filter cake? If you are see this picture, the picture which is shown, raw slurry which is shown for the filtration, filtrate will come down, and there is a cake layer, red color, which is formed solid material, it will block. So you have to remove or rinse. Additional rinsing of the liquid is needed to make the filtration properly. So what do you mean by filter cake? They have given a choice. The cake which is to be filtered, a porous membrane used to retain the solid. What answer? Porous membrane to retain the solid is called filter medium. It is not filter cake. The cake which is to be filtered, who will think about cake which is to solids which are present on the filter shown in the picture. The solids, first the red color dot, they make one by one and they are making a big solid. A suspension to be filtered. They have given 4 choices, but the answer, what do you mean by filter cake means, you can see in the picture, filter cake is from the slurry, the solids which are present on the filter paper or the filter medium, which is very solid cake, that is called cake, which allows not to follow. Which one of the following process is used to separate insoluble particles from liquids? How you are insoluble particles? Very simple, filtration. You are studying about filtration topic. So answer is filtration. Very clearly the student can say now itself. One who listened from the beginning, they can answer separation of insoluble, soluble particles. Filtration cannot, because the solvent will the solution will come down. But if it is not soluble, they can be filtration. Extraction is not having separation. It is extracting the solubilized, drying, removing the volatile or the solvent. Sieving, you can see the sieve which I have shown. Sieves, you have seen in the lab also. Size separation it is. You are separating the size, but it is not possible to use for insoluble material in a liquid to undergo a process is called filtration. Which one of the following does not influence filtration? Filtration means everybody knows. Normally you should think about what you are doing in the home. You are doing a small tea or a coffee, tea especially. You are doing a filter and filtering the tea powder which you are using preparing tea. So what will filter? If you are agitating, shaking, it will improve. Or if you are pouring a little faster, it will be. Or sometimes it may heat also can help temperature. So temperature also sometimes filtration will improve. Density also have an impact. Viscosity also having an influence in filtration. If more viscous, it will take more time for filtration. So that is also. But pH, the pH is not having any influence in the filtration. So here the choice is, they are given 4 choice in which pH is not our answer. It's not having influence in filtration. Other all things are having in filtration. And size, clarification is also known as one of the following terms. Clarification means separation actually. You see the picture below me, the sieves number, the bigger number. You know the 1 square millimeter, the size of the separation, the holes decide the size of the material. So they are given size. Clarification is also known as one of the following. Clarification means separation especially. So you can see sieving, shifting, screening or additional name for size separation based on different size, shape and density between the particles. The techniques is used. So the answer they have given for size clarification is also known as one of the following. So we have to see size analysis, size distribution, size reduction. I think size reduction and then size separation. So size separation is called clarification. Not clarification, classification. I was telling clarification, classification, separation. So very simple, the student, I told him, very sorry, I am using clarification. It is not clarification, it is about classification. So when you want to classify, when you are studying classification, this pharmacological classification, chemical classification, physical classification, whatever classification, we are finding the difference and you are separating them. So classification of any size of a particles, it can be done, it can be given another name is size separation. And size separation is not based on particle density. Size separation is not based on particle density. Particle density is not having any influence in size separation. Particle shape also. When you are separating in the sieve, shape doesn't have any impact. Sometimes uniform shape, uniform size, they may go inside the particle size. So you see, almost particle density, particle shape, particle size, the size separation is not based on, they are asking, it is not based on. So, but it is based on density, shape, particle size, because when you are separating small size, big size, mesh 20, mesh 44, mesh 4, like that. But texture, what is its texture, how the shining or rough, this is not having any impact for size separation. Size separation by size, by density, by shape, it is possible, but usually by size, by sieve and all size. shape, if it is shape also, sometimes if it is different, sometimes it may not go inside, oval shape, round shape, like that. Small difficulty is there, but we cannot say it is not based, it is also based on size separation. But texture is not having any influence in size separation. So students should remember this. And which one of the following indicates the nominal size of aperture? Nominal size of an aperture, the whole of the sieve. Area of the mesh as a percentage. Distance between two adjacent wires. Number of mesh per linear length. That you know, number of, that's why we told number of aperture, number of holes in a square 1 millimeter decides the number of the sieve. That you might have studied in British Pharmacopoeia. So number of mesh or number of mesh per linear length, which is indicates the nominal size aperture of an sieve. Wires having specific diameter that gives suitable aperture is not giving the nominal size for the aperture. Nominal size of the aperture, number of mesh in one length, 1 millimeter, 1 millimeter, how many aperture is there? That is the decision for the nominal size of aperture. During size separation, the movement of the particle can be enhanced by agitation. That is, everybody say, in home we used to do. You can see the picture, that person is just agitating and sieving. Attrition is size reduction, it's not having any impact. Gravitation is simply, if you keep, it will not give any particle enhancement. You cannot expect for a powder. For a liquid is possible. Mixing, I don't think it is having. So agitation will give you a part. And who is the father of medicine? We have just seen in the first slide. That is Hippocrates. There is a prescription also as shown, that is papyrus prescription in Egypt. And you can see the sea god, Greek god, is called Pontos. Pontos means the ancient sea god. So they are given a choice. First one is Eber. There is Eber. Eber's is you can see there is a prescription. Hippocrates is the father of medicine. Pentos is the god of sea god, Greek. And Egyptian is the Egyptian tomb, they have the prescription. It's not having the father of medicine. So use of formulation made up of various constituents of the plants is referred to as galenicals. Galenicals is the answer for formulation made by various constituents of the plant, galenicals. Parenterals, you know the picture, injections, syringe, needles, whichever. There are many vials, ampules, plant, vehicles. Simply the answer is not. Generics means generic drugs. It doesn't have any impact with the formulation of various constituent of plants. Plants, for example, generics means synthetic drugs name directly they will give. So that is not a plant constituent formulation. So you can say galenicals, which has been prepared by especially Avicenna, the Arab scientist who was first, they have made, most of the time they have given contribution from Arab contribution. Here next question about the Baghdad first pharmacy and Indian pharmacopoeia also, they have given the year, they have asked a question. So 27, the question is, first pharmacy shop was opened in, actually everybody knows it is in Baghdad. It's not in London. It is in Baghdad. You can see the picture. It is in Baghdad, Iraq. Is the first pharmacy. It is called Sadelia, made up of sandalwood. And Bangalore they simply gave. Damascus is the Syrian capital. No, it is not in Damascus. It is in Baghdad. The first edition of Indian IP was not in 1965, not in 1975. It is 1955. and 1985, not in 1985. The answer is first edition of Indian Pharmacopoeia was released in 1955. You can see that next question, the Pharmacy Act came in force in which year? Actually the act is 1948. The function were Pharmacy Council of India, and the Pharmacy Council of India constituted in 1949. The act is in 48, but the constitution of Pharmacy Council India was constituted for 5 years in 1949, and it contained elected members, nominated members, and ex officio member. These all things students should remember. Pharmacy Council of India. They may ask question like this. And in 1947, no. 1948, the act was in 1948. 1949, not the act. Council was established. 1950, no. And Pharmacy Council of India were established in 1947, no. 1948, no. 1949. So you have the answer two questions very easily. You will remember, I hope. The act was in 1948 and the Pharmacy Council was established in 1949. And you can see what is USP, United States of Pharmacopoeia, the picture I have shown there, and they have national formulary also, and the active ingredients, what is API also I have given, that means active pharmaceutical ingredients, because they have given a choice like that. United States of Pharmacology, no. United States of Pharmaceutics, no. United States of Pharmacopoeia. United States of Pharmaceutics, they have given a choice. Drug converted to suitable form are known as, the drug is converted to suitable form excipients? No. It is other than the active principle is called excipient. Source of the drug? No. And dosage form. The drug converted into suitable form is called dosage form. A dosage form may be a solid unit dosage form, tablet, capsule, or a syrup, or an injection, or any type of, or a transdermal, or whatever may be. It is the dosage form is called the drug is converted into suitable form is known as dosage form. So APA means they have given even a choice. APA, active pharmaceutical ingredient, but active pharmaceutical ingredient or an active principle, it is not a dosage form. It is not a converted suitable form of patient to take a drug or administer. So dosage forms are the suitable forms which is known. And you can see now additives means what, and what is the aerosol, and what do you mean by this? For example, if they are metered valve, there will be, when you press this inhaler, dosage can be also measured by means of now the new technology for inhaler. So additives are important components commonly used as a low concentration in excipients. Usually they are not used. Additives provide a certain function. It will enhance the stability because you are using preservatives, colors, and preventing and sometimes binding, modify the pH, prevent microbial growth. These all advantages are there. So full form of MDI means what? MDI. MDI means metered dose inhaler. The picture which shows the metered dose inhaler. And metered dose inhalation, no. Inhaler. And metered drug ingestion, no. Metered drug infusion, no. Metered dose inhaler. And every dosage form is a combination of the drug and different kind of non-drug component are called additives. Just read the question again. Every dosage forms is a combination. Dosage forms are combination of drugs A, B, C, and different kinds of non-drug, that is called additives. Components are additives. Maybe a binder, maybe a coloring substance, maybe a filler. So there will be a lot of others. There will be diluents. So they are additives. Non-additives, additives, and new chemical entity, and all of this. No, they have given simply, the answer is not having any meaning. Additives, the answer. And you can see here the picture which shows hard gelatin capsule, soft gelatin capsule, and a syrup picture, capsule made up of gelatin, hard and soft. And capsule in which powder are enclosed, made up of. So they are made up of gelatin. Even soft gelatin capsule or hard gelatin capsule. The answer first itself they have given gelatin. The answer is gelatin. Rice flour, no. Dextrose, no. Fructose, no. So it's easy, actually the answer A, B, C, D, that is jumped, dextrose and fructose. Answer is gelatin, that you can remember. Concentration of simple syrup according to USP is, because IP is different and USP, 85%. In IP it is 66 point and this is 85% weight by volume. 76, no. 95% weight by volume, no. None of this. The answer is, according to United States of Pharmacopoeia, the concentration of a simple syrup is 85% weight by volume. And you can see this is, before going to the question, I have given some details. Sucrose 67.7 for a sweetener and purified water. This is the percentage of simple syrup by Indian Pharmacopoeia. 66.7 grams of sucrose dissolved in water will give a simple syrup. The sucrose formula, you can see it is made up of glucose and fructose, and the linkage of O, alpha and beta linkage, the picture which I have shown there, and the structure of a glucose molecule and a fructose molecule can be seen there very clearly. So they have given in purified water the concentration of the sugar in a simple sugar according to IP. It is 67? No. 66.7 actually. That is correct. According to IP, simple syrup concentration is 66.7 weight by weight. And 65% weight by weight is no. 77% they are given weight by weight, no. And the syrup is nearly saturated solution. The syrup is nearly saturated solution of. A syrup means saturated solution of what? Whether it is sucrose, sorbitol, glycerin or polyethylene glycol, PEG. It's sucrose. Everybody knows syrup is made up of sucrose. That's why I just shown the structure of sucrose. You can see the down, the sorbitol structure is given, and glycerin structure is given, and polyethylene glycol structure is also given here for the students to see. If they are giving some structure and identify which one is sucrose, you should know that sucrose is an disaccharide which contain both glucose and fructose together. It's a reducing sugar. Simple syrup, also known as sugar syrup or bar syrup, is a basic sugar and water syrup. And I just given what is simple syrup. The question, you should, before going to the question, if you see this type of points, then you can answer very easily. Elixir is a sweet hydroalcoholic solution. Water and alcohol liquid of oral use. So syrup and elixir, the difference student might have studied very clearly. The syrup is nature was published in, or it is prepared in aqueous. This is the correct answer. Non-aqueous nobody will prepare. Gas it is not used. Solid it cannot be used. It cannot be prepared in a solid form. It's a liquid. Syrup means liquid. So aqueous. Elixir are, the answer is, it is, and they are hydroalcoholic solution. Hydroalcoholic solutions. Aqueous, but alcohol should be there. Viscous, we cannot say it is completely more viscous because alcohol is there. Semi-solid, it's not an ointment or a cream. So elixir are hydroalcoholic solution. You can say next, before going to the question, I have given some important hints like liniments are not applied to the skin area that are broken or bruised, that means somewhat scrapped, because excessive irritation might result. Throat paints is a valuable pharmaceutical formulation designed to alleviate symptoms of throat infection through target local application. And you can see liniments are monophasic liquid dosage forms. And liniments prepared by dissolving camphor, menthol, because liniment will relieve pain, and olive oil, vegetable oil using water bath. The methyl acid salicylate, even liniment is added, olive oil, vegetable oil, and added for dissolving to complete. Activity, the liniment is an anti-inflammatory analgesic action is there. Question is, liniment must not be applied on the skin. In what condition? We know the answer. Swelled, no, swelled we can apply. Broken skin, broken tissue we cannot apply. Painful we can apply. Normal skin also we can apply. That is the answer. 42. Which vehicle is used for as a throat pain? Throat pain, when you are using inside the throat, when you are applying, what is the vehicle? Vehicle means not car or a bike. We are talking about the vehicle, the liquid, the solvent which you have used. Glycerin, because it soothes. So glycerin is the answer. Water, no. Syrup, no. And solution, no. You can say glycerin is a vehicle which can be used for throat pain, throat paint preparation, formulation. And now again another next question when you go, I have given that is posology means what? We should know. Posology is about the dosage forms and the directions, and the pharmacokinetic process of absorption, distribution, metabolism and excretion undergo changes due to the growth of the development. Growth and the development. For example, pediatric dose, adult dose, the adult dose will be more and pediatric dose will be less, because the distribution, metabolism, excretion will be changed according to the growth development. The development of the heart, development of the liver, development of the various parts in the child and the youngsters, it will be different, and even it will be different for pregnant women, and it will be different for adult and the child. So that's why the dose is different. You can see the picture also. We have shown that is 100 milligram. For adults sometimes common in the flat dosing. But body size also sometimes the dose will differ. But at the same time, when you are seeing a group of adult like men and women and children, there is a dose is becoming half. So the dose is reduced in pediatric. Posology is a branch of pharmacy which deals with what? Whether it deals with study of dosage forms, study of doses, not dosage forms. Student should know that it is not dosage forms. Study of dosage forms means studying about tablet, capsule, injection, syrup. But doses means what? Study of doses. TID, BID, or what is a milligram. Study about the dose. What is the minimum concentration needed for their therapeutic action? So study of drug interaction, that is different study, not posology. All the above is also wrong. So the study of doses is the correct posology. Pediatric doses are lesser than normal doses, because you know that we are told that the development between the adult and the child is different. Of the other lower body size, no, not because of other lesser body weights, their immunity system is not well developed. These all are not correct by means of for periodic dose. The immature state of their hepatic, that means the development of their organ, hepatic renal function, by which the drug are inactivated and eliminated from the body. So immature state of their hepatic and renal function, by which the drugs are inactivated and eliminated from the body. So pediatric doses are lesser than normal dose. This is the reason why we are giving less dose for the pediatric dose. And we can see this slide. There are some points which you have to remember before the question. Taking some medicine at the same time as eating may prevent your stomach, intestine absorbing the medicine, making it less effective. So this is a question, maybe why should you take drugs before meal and you should not take with the meal, or that is the why, that may be the question. So they say that very clearly, eating sometimes some stomach intestine absorbs the medicine, making less effective possibility, and some of them are making chelate also. We cannot take tetracycline with milk. So by that is biphosphonate or ciprofloxacin, which is common antibiotic, can bind with themselves with the mineral content obtained from the food. So this can diminish the property and make them less effective if you take along with the food. So they will say before food. That is also one reason. When a medication is administered intravenously, it is directly reaching to the blood circulation and their bioavailability 100%. The question may be why we are giving less dose in injection than in tablet. That may be the question. Anyhow, we will see the question. Question number 1, in this 45 they ask, some drugs are advised to take before meals. To why? Avoid dose dumping? No. Avoid interaction with food? No. Improve absorption is the correct answer. Because absorption may be hindered. That is the answer. Avoid interaction with the food is not to avoid. Interaction food is not avoiding. They want to, the food may hinder the absorption. So that's why they told, take the drug before meal. The answer should be correctly you have to select. Both B and C also you may feel that it is correct. No. Avoiding dose dumping is wrong. So automatically avoid interaction with the food is wrong. See, together it cannot improve absorption and avoid, that is both together it is not possible. So a lesser dose is required for a pediatric dose. A lesser dose is required if the dose is given by why? For example, when you want to give an injection, lesser dose is enough. Oral route, topical route, intravenous route. So in these 3 routes, intravenous route, for example, for paracetamol, a single dose, you have to give 500 milligram. Nowadays 650 milligram, 1000 milligram also taking for a dose. But in oral only 50 milligram. So the dose is less in intravenous route. So a prescription is an order written by the registered medical practitioner to whom? You say it is RX is given to the pharmacist. With no doubt you can write. The common abbreviations also they have given, I have shown here. You should remember, AC means anti-sebus before meals, BID means bis in die, twice a day, PRN is pro-re-neta, that means as needed, and Q3H means quack-3 haram after every 3 hours, QD, quack-die, so every day. So like that you should know that the words are done by Latin terms, abbreviations which you used to study. The prescription is not directly given to the patient, it is given to the pharmacist to be distribute the drug, not a compounder, not a nurse. In which language the abbreviations of the prescription written for every common, especially in the dosage instruction. Just now I told, here also we have read Latin term, not Greek, not French, not Hebrew. So this is RX which you might, and this is two things which you have to remember. This is a symbol, and the symbol is the prayer to the Jupiter, the god of healing, that is the planet, for quick recovery for the patient. But now its symbol is understood as an abbreviation of Latin term recipe, meaning take thou or you take, and the superscription is represented by the symbol RX. That is what very clear. This not DC, not PH, not doc. And you can see in the day of mythology, the symbol RX was considered as a prayer to Jupiter. Jupiter is a god of healing, not Jesus, not Neptune, not Dhanvantri. So you can see now we are going to discuss about what RX means. A medical prescription in the medical technology, RX is an abbreviation that stands for the prescription, superscription. Symbol is usually said that in the Latin word recipe, meaning to take. You can see the candid cream dusting cream which I have given an example. RX, you take. The meaning is exactly. The name is you take. To make, no. To sold, no. To use, no. Powder used in external use for. Powders used for external use are, you can say dusting powder, example candid powder, external antibacterial, antifungal powders are there. Bulk powder, no. Divided powder, no. Effervescent powder, no. And now we are going to discuss about active charcoal and also insufflation. What do you mean by insufflation? 2-3 places they have asked this question. So student, remember, insufflation means inserting into the body cavity. Breathing difficulty, your nose, mouth, ear, and even heart, stomach, even intubating. If nobody cannot swallow or eat. So there are in the cavities, even all the cavities, even in our knee, suppose uric acid for treatment. So many treatments you can inject. So that is called insufflation, is a formulation which is a form of dosage form which can be injected directly to the cavities of the body. Bulk drugs are, bulk powders are potent. No, bulk will not be potent. Non-potent is the correct answer. Both A and B, no, you cannot say. None is also not, you cannot say. It's an easy question. 54. Insufflation, the student should remember, are introduced into which of these body cavities? Nose, yes. Throat, yes. Ears, yes. All the above. Even not only there, many other parts also is possible. Knee, hand, and even for large intestine, small intestine, lungs. Why not through even vagina or by means of rectum? There are many. Now powder media are typically more stable than liquid media, therefore tend to have a longer shelf life. So our question is, which is having more shelf life maybe? And powders are more stable than syrup, tablets, capsules, elixir. Due to their large surface area, they can absorb very easily. Minimal exposure to the moisture and light, include degradation and ability to storage in the airtight container. Binders, about binders also there is a question. Binders are granulating agent which will, the powders are made into granules and then only compression takes place in the tablet. Are a critical formulation component in tablet made up of direct compression as well as dry granulation, wet granulation, direct compression. You might have studied the melt granulation. Ensure appropriate plasticity, compatibility and binding ability. The question is, powders are more stable than syrup, 100% sure, capsule, tablet and elixir, but actually they are more stable than syrup. We cannot say capsule cannot be compared because they are more stable than a powder. It is completely packed. Tablet, elixir is alcoholic content. It's an hydroalcoholic solution, so it is comfortably stable and suitable for adding to maintain the powder until the mass becomes coherent but not too damp. Coherent means it's not becoming very damp mass like a clay, but not becoming coherent. So what you will do? Is it coloring agent can be added? No. Flavoring agent can do the coherency. Sweetening agent and can prevent the coherent. No. Granulating agent, binding agent, granulating agent, binder like starch, PEG, which can help for maintain the powder until to get a mass becoming coherent, not for damp. Damp means addition of more water, more liquid, it may become damp mass. You can see the picture. I want to be made into granules. So granulating agent can also be called as binder. Diluent acts as a filler in the pharmaceutical tablets, increases the weight and improves the content uniformity. Douche means what? Douche powder. There is a word douche, even they have given. It is not an answer, but still the student should know sometimes. What is douche? Douche powder are used for hygienic effect. A pack which is used for douche powder containing, as you see, that is vaginal douche, feminine for used for sterilization and for antiseptic action, containing specific therapeutic anti-infective agents such as those mentioned in the discussion of vaginal suppositories and used for against of monilla and trichomona infections. So this can be used. So again, what will increase the bulk of the product? Bulk of the product can be increased by diluent or filler. Processing aid? No. Diluent, or you can say filler also. Granulating agent? No. It is for only for coherent increasing. Understand? And organoleptic additives like color, flavor? No. And which one of the following is used for irrigating or cleaning vaginal tract? That you can say finely divided powder or bulk powder or effervescent powder. No. Douche powder. A douche powder which is hygienic effect, which can be used for vaginal cleaning purpose. Now we should know liquid dosage form. Monophasic means monophasic dosage form results a liquid preparation in this only one phase representing, that is solution. You know that is biphasic like emulsion and suspension, which is pharmaceutical preparation, most important preparations. But monophasic means solutions. Solute is completely soluble. And surgical dusting powder are also used mainly body cavity, burns and umbilical cords, and infants result in major wounds. A solution of homogeneous mixture, one or more solute dissolved in a solvent, and the substance in which the solute dissolved is produced to an homogeneous mixture is called solution. So solution, monophasic dose refers to an liquid preparation in which there is only one phase represented by a true solution. The question is, which powder must be sterilized before their use? Medicated dust powder? No. Non-medicated powders, natural dusting powders, surgical dusting powders should be sterilized. The powders which is used for surgery. The monophasic liquid dosage form is solution. Is it true? Yes, it is solution. Coarse, fine, micro. No, it is true solution. It is called true solution. Monophasic dosage form is solution of true solution, which is completely soluble. And now solvent with solute, you will get solution. Solvent is a material which is usually decided the solution the physical state, solid, liquid, gas. The solute is the product that the solvent dissolves. The component present in the solution is small. That is solute, everybody. Solvent is wider, no. Solution is the complete. Solute is the small one which is solubilized in the solvent, liquid. And number 62, the component present in the solution is large quantity is known as, very simple, solvent. Solvent is the large quantity, understand? So solution is the product, solute is a small quantity, liquid simply they gave a choice. And 62 before, when you want to go for the next question, before that, let us see what is monophasic dosage forms. Refer to liquid preparation in which there is only one phase, that is solution, and is represented by a true solution. This already we have read. And the solution which consists of two phases is known as biphasic liquid. Example, emulsion and suspension. In general, both the phases of liquid, while in suspension the fine divided solids are dispersed in a liquid in a continuous phase. But emulsion, two immiscible liquid, one is dispersed in the other. Remember this. The local pH inside the nasal cavity directly influence the rate of extent of the drug absorption. So always we will talk about internal organ like eye, nose, even throat, vagina or rectum. Anywhere when you are giving any internal organ solutions, we will talk about the isotonicity. It should not get any irritation. So the pH also very important. So it is suggested that optimum pH of nasal spray ranges from 4.5 to 6.5. So they might have questioned, you can say 4 to 6 also. They might have asked a question, what is the range of the pH for a nasal spray or a nasal inhaler, or none of the formulation component should be irritate to the nasal mucosa. Its pH should be similar to the nasal mucosa, 5 to 6.5, and it should be isotonic. The pH should be the same of the body fluid which is present in that particular cavity. Solution or the dosage form, monophasic. Exactly. It's not biphasic, it's not triphasic, it is not solid. Any student can easily write. Nasal drops should have a pH, it should have an isotonic, and it should be 5 to 6 not. Just now we have seen 5 to 6 is the correct one. We cannot say it is 5 to 6, but 5.5 and 6.5 they have given are 4.5 to 6.5. 5 to 6.5 is limit. But anyhow 5 to 6 we have given here the choice. We see 6 to 7 no, 7 to 8 no, 8 to 9 no. So 5.6 is the correct answer. So now we are going to talk about an isotonic solution in an external solution that has the same solute concentration and water concentration compared to the body fluid. In an isotonic solution, no net movement of water will take place. This is also, see the picture, hypertonicity picture, hypotonicity picture, isotonicity picture. So it says in hypertonicity, what will happen? Plasmolysis will take place. Hypotonicity, cytolysis will take place. But in isotonicity, aversion means it doesn't make any problem. The formulation can be applied to the cavity of which you prefer. The pH of the product can affect the stability of the drug, affect the preservative as well as the viscosity of the formulation. pH of modifier is also there, that is called buffer substances, buffer solution. Buffers are said to be pH modifiers, are an important component of aqueous based tropical dosage form. pH modifier include acidifying, alkalizing, buffer agent. So sometimes you can say acidification, it will also change the pH. Basification is also change the pH. Buffering agents can also be used for maintaining the pH. Nasal drops are isotonic. Say strongly, they are not hypertonic, they are not hypotonic. None of the above is not the answer. Buffer agents are also called as sweetening agent, no. Thickening agent, no. pH modifier you can say. Wetting agent you can say. So the answer is buffering agent can be called as pH modifiers. Now we want to talk about some of the points about saccharin. Is a synthetic sweetening agent in a non-nutritive and artificial sweetener It is made up of laboratory by oxidizing the chemical of orthotoluene, sulfonamide and phthalic acid or phthalic anhydride. It looks like a white crystalline powder. In the structure you can see a benzene with double bond ONH and the COSOO. And the suspending agent, this is another point which you have to remember for the second question or the second question. Suspending agent are hinder coalescence, adhering the particles may be either water soluble polymer, often called protective colloids, or finely divided insoluble inorganic compounds. It can be claimed that suspending agent increases the viscosity of the continuous aqueous phase, thus improving dispersion. So we know that suspending agent viscosity plays a major role, so that we are using even acacia, tragacanth even, they also increase the viscosity of the liquid, or you can use even glycerin as a medium vehicle, which can also improve the suspending capacity, but they need the surface acting agent. So suspending a flocculated, deflocculated suspension you might have studied, so which can be prepared by suspending agent, biphasic liquid. Saccharin is an example of natural sweetening agent. No, it's a synthetic. Flavoring agent? No. Artificial sweetening agent is correct. And humectant is wrong. Suspending agent imparts solubility? No. Viscosity? Surely. It increases the viscosity. Adsorption? No. Absorption? No. Wetting? No. So this is the answer. And now disodium EDTA is an example of, you can see I have given some examples and some of the things which you have to remember before the choices which is given. The structure of EDTA, ethylene diamine, you can see ethylene, 2 amine group with tetraacetic acid, that is the name. And the chelate, it's a chelating agent because of 4 units of carboxylic acid, which can get easily donate electrons, and as well as it can make chelates. A complex can be formed. So chemical compound with structure prevents attraction to the 2 or more donor atoms on the site. It can, metal ions can easily make complex. Calcium complex with EDTA you might have studied. Simultaneously produce 1 or more ring. You can see the picture. There are some coloring agents which I have shown. Amaranth. The picture which is shown in below, the amaranth, reddish color plant, it's a natural color, amaranth. But when you see eosin, other colors which they are shown in the here in the side, they are synthetic. Any sweetening, is it EDTA is sweetening agent? No, it's not flavoring agent, it's a chelating agent. As I told, it is ethylene diamine tetraacetic acid. It's not a preservative. Which one of the following is natural colorant? Amaranth is the natural colorant, which I told it's a red color, and eosin, yellow color, which is not, it's a synthetic, and tartacin, we can see tartacin, which is a pink color, which is not it's a synthetic product. Eosin, the maroon color, which is, it's also synthetic coloring agent. And now we can see a bug, a red bug, that means red bug which is shown there, it is also a coloring agent. Natural bug will produce in the plant, which is and cochineal extract is a caramine. This a caramine have a long history as a dye for food, cosmetic. That cochineal is prepared from this red bug and cosmetic and pharmaceutical and textiles. Simethicone is, you know, it's a drug medication used for management of treatment of flocculent and gastric problem. It's have an ability to anti-foaming effect. Mechanism of action is contraindication. Simethicone as a valuable agent to control excess of gas production. Simethicone is a defoaming agent and reduces the surface tension in the mucus, allows entrapment of air bubbles to coalescence and disperse, and promotes the expulsion of the intestinal air. That's why it was used for gastric issues in patients who are having difficulty, and anti-flatulant. But here the question is, colchicine is a flavoring agent? No. Sweetening agent? No. It's a coloring agent. Thickening agent? No. It's a coloring agent, which is a natural coloring agent which is produced from a red bug. And which one of the following is anti-foaming agent? Anti-foaming agent is simethicone. And methyl cellulose? No. Aspartame? No. Sucrose? No. And simethicone is the example, is the answer for an anti-foaming agent. And now the next question is, which one of the following is not a vehicle? Means not a bike or a car, not a vehicle for preparation of a suspension or a solution. That's what. So you can see they have given a choice of butylated hydrotoluene. That's why I have taken, it is an antioxidant but used as a preservative in the food and animal feed, and so it cannot be used as a vehicle for pharmaceutical preparation. It's used for rubber, plastic products. And you can see a picture which I have shown here. Water and oil to be mixture, immiscible liquids, how it forms an emulsion, oil in water emulsion. So cimetidine, emulsifying wax, fatty oil, alcohol, along with function of relative weak emulsifying agent, water in oil type. They will ask what is macrogol also. Macrogol is used as a surfactant. Even it reduces the surface tension between the immiscible liquids, but it can be used as a spermicide and as an it will as a spermicide. It stops the sperms to move by means of its surfactant acting agent. And the solvents and non-ionic emulsifier. Macrogol is also emulsifier. So glycerol is a vehicle which is commonly used in pharmaceutical industry. Water also very common. But butylated hydroxytoluene cannot be used. That's why I told you it is a preservative and it is a chemical which cannot be oral route. Rose water can also be used as a vehicle. And you can see cimetidine or macrogol are an example of not sweetening agent, not coloring agent. You know very well, we have read just now. They are surfactants. They will reduce the surface tension between immiscible liquid. So surfactants means they are emulsifying agent like Tragagan, Tween20, Tween80. They all are having surface acting agent which reduces the interfacial tension, and they will make two immiscible liquid to be one to be dispersed in the other. None of the above is not the answer. So cimetidine, macrogols are emulsifying agents. So now we want to talk about what type of emulsion is water in oil in water. So is it a primary emulsion? No, primary emulsion means simply water in oil or oil in water. The nucleus will form 4 parts of oil, 2 parts of water and 1 parts of emulsifier. It's a symbol. Multiple emulsion means they are complex polydispersed system where both oil in water and water in oil emulsion exist simultaneously, which are stabilized by lipophilic and hydrophilic surfactants respectively. So this is the answer, 100% sure, because water in oil and this one is oil in water emulsion in the same emulsion. Micro emulsions are size of the globules, nano emulsions of the product, the size of the fine droplets, especially between 1 to 5 micron. Micro emulsion, 1 to 50 micron, that is nano emulsion. So our answer for the type of water and oil in water emulsion is not a micro emulsion, it's a multiple emulsion. It's not a nano emulsion, because nano emulsion or a micro emulsion, they are talking about the size of the globules. The tail of the surfactants molecules in oil loving are known as, if it is oil loving means hydrophilic, very simple. I have just shown the picture of the tail of the surfactants, which is non-hydrophilic, a non-polar hydrophobic. So it is, whether it is hydrophilic? No. Hydrophilic means water loving. Lipophobic means it is hating lipid or water loving. Lipophilic means oil loving, lipid loving. So it's correct, lipophilic. Hydrophilic means, again repeatedly the answer has been given, it is wrong. And now in stability of emulsion, which important instability step should be prevented? Stability. So emulsion means always student will think about coagulation, breaking, creaming. So you see an emulsion can go for flocculation, creaming, in the picture you can see, coalescence and breaking. So for breaking, after flocculation just joining, it comes to larger particles of the dispersed medium, coalescence. Coalescence should be prevented, very important. And a dye test can be done by means of scratch red dye test for identifying oil in water or water in oil, continuous phase. If it is oil, the solubility of the scratch red dye will helpful to find out red color, which is shown in the picture. If an oil dissolvable dye, scratch red C or a Sudan 3 is mixed to an emulsion on a continuous phase appears red, then we can say it is a water in oil emulsion, very clear. As a water soluble dye, another natural amaranth can also be used for oil in water type of emulsion for test. So this 77 question, in a stability of the emulsion, which important instability steps should be prevented? Which one? Coalescence should be prevented, so that no cracking, no creaming can be prevented. So flocculation prevention, creaming prevention is not possible. It's not important for an instability. Mainly you have to stop the coalescence. Which dye can be used for identifying type of emulsion? Scarlet red. Scarlet green is not there. Crystal violet is an titration indicator. Methyl blue is titration indicator. It cannot be used for dye test for emulsion. This is a picture. Emulsion can also be tested by electrodes. Conduction of by means of that the bulb will glow if it is water in oil emulsion. The oil emulsion, it can easily we can identify by the conductivity. So you can see that is in conductivity test the bulb glows passing electric current, so that would be the type of emulsion. Water in oil emulsion or oil in water emulsion is can be, because water is a continuous phase, it's an easy conductor, very easily conduct fast and light will glow. And micro emulsions and multiple emulsion, but oil in water emulsion can be easily identified in by glowing. Water it will be continuous phase. So when you see here in micro emulsion, the size of the globules are, they are given 1 micron, 2 micron, 3 and 0.01 micron and 10 micron. The answer is 0.01 micron, because you should know the particle size of micro emulsion ranges from 10 to 300 nanometer. nm means nanometer. So 1 micron is equal to 1 micrometer is equal to, you can say equal to 10 to the power of 6 micron. So you can see 1000 nanometer is equal to 1 micron. 10 to the power of minus 6 meter. I want to say that much. Meter is not compared, very meter you know. But here 1000 nanometer is equal to 1 micron. So when you say about nanometer, nm, it is usually they say 300 nanometer, 10 to 300 nanometer. So the answer is 0.01 micron means it is 10 nanometer. And 300 nanometers. 2 micron means it is more than 2000 nanometer is not very big. 10,000 nanometer very big. 1000 nanometer is also very big. So microemulsion size is 0.01 micron. Nanometer means it is 100 micron. That is 0.01 micron means 100 nanometer. Like that the student should know conversion of microns. Creaming or sedimentation can be hindered by having high viscosity continuous phase. That is also coalescence is a smaller droplets merge together forming larger droplets, which we have seen in the picture. If the viscosity is continuous phase increases, so creaming will occur. Creaming dash they are given. What is that? No change, increases, decreases. So viscosity continuous phase is increased, creaming can be reduced, because you see creaming and sedimentation can hinder. The word hindered by having a high viscosity in the continuous phase. That is the concept. Viscosity of the continuous phase is increased in an emulsion. Automatically the coalescence will come down, the creaming can be suppressed, or the flocculation can be reduced and creaming can be reduced. In case of coalescence, dispersed droplets do not fuse. I think it is wrong. Globule size decrease. No, it is increased, the picture itself. No globules or number of globules, simply they are given. Dispersed droplet tend to fuse. That's why they become big and they become immediately cracking or breaking will take place. And now we should know cod liver oil, butter, milk, they are all emulsion. Cod liver oil, they contain water, but the main thing is oil. That's why water in oil emulsion. Cold cream, we know that it is water in oil emulsion. Butter, water in oil emulsion. But your milk is oil in water emulsion. Why? Because which is fat dispersed in water. Which one of the following is not an example for water in oil emulsion? A very good question. Cod liver oil? No. Butter? No. Because they are water in oil emulsion. But milk, oil in water emulsion. Which one of the following statement regard emulsion is false? Emulsion cannot be separated into their constituent liquid. How? It can be separated. Even temperature increased means or surfactants destroyed or microorganism attack, it will separate. Emulsion shows Brownian motion. Emulsion shows Tyndall effect. Emulsion exhibit properties like electrophoresis and coagulation. Emulsion cannot be separated into their constituent liquids. That is the statement which is, we can say, a false. Because it can be separated. It will be separated. So these other things, emulsion shows Brownian motion is correct. Emulsion statement is okay. And emulsion exhibits properties of electrophoresis because there is conduction, movements of particles, coagulation, all these things are there. So that is very important to be remembered by the student. And this is cake. Even in the suspension, now we are talking about suspension. Emulsion is over. Rising the dispersed particles of the surface, the emulsion is referred to a cream, that one. Second, the picture which shows creaming. And you can say creaming. First one is creaming is reversible, irreversible, both A and B. Because it can be reversible, it can be irreversible also. Long time if you make the cream to stay, it is very difficult to make them back. So upward creaming is observed in upward creaming. That is the picture, not suspension. I told wrongly. Here the picture shows upward creaming, downward creaming. So we should know where the upward creaming and downward creaming. Upward creaming is due to the less denser, the down in continuous phase, less denser, internal phase. Normally observe in oil in water, water is less denser, so oil in water emulsion you can see upward creaming. Downward creaming also possible, internal, if the water and oil emulsion possible to come down. So that is what we have observed. So they have asked, upward creaming is observed in water and oil? No. Oil in water, because water is little less denser. Both we cannot say. Micro is also cannot say. So we want to see solution, colloidal particle suspension size. Particle size is less than 1 nanometer of our solution. Particle size is 1 nanometer to 100,000 nanometer, and particle size in suspension it should be more than 100 nanometer. It is used to actually in deflocculated particles structure of the vehicle may form in the suspension. Solid hard cake upon strong storage or long storage, not strong storage, long storage, the risk of the cake may be eliminated by forming flocculated particles in a structured vehicle. So you can see particle size of the suspension is less than 1000 nanometer. No. It is 100 nanometer. No. Greater than 1000 nanometer is the correct in the picture suspension particle size. 10 nanometer is also wrong. Pharmaceutical suspensions are generally flocculated because they are flocculated. Deflocculated is also there, but flocculated shake, distribute and then dispense. So most of them are flocculated. And you can see increase the sedimentation rate by increasing the size of sedimentation particles. Sedimentation rate increases size of the particles. Hence the flocculated suspension sediment more rapidly. Because their size will be more heavier, they will pour. And here the sedimentation depends on the size of the flocks. Flocculated particles weak bonded, settle rapidly, but it can be easily distributed. But deflocculated, the particles slowly deposit, but it is very difficult for them to re-suspend. So rate of sedimentation is high in flocculated suspension is the correct one. Deflocculated rate will be less, but the cake will be difficult to separate. That you remember just. So it will be easy for you to always pharmaceutical preparations are flocculated suspension. Cake formation is a characteristic feature of flocculated suspension. Deflocculated suspension is a solid cake, but flocculated suspension cake will form, but it can be redispersed, be resuspended by shaking. So thixotropic solution suspension, no, and structured suspension, no. The answer is deflocculated suspensions. They are very much characteristic to form a cake formation. Sedimentation volume can have a range of less than 1, and the calculation for the sedimentation is F equal to VU by V0, where VU is the final volume, ultimately the volume of sediment. V0 is the initial original volume before cake formation. By that you can find out. So usually the ideal suspension, the suspension volume should be 0, no, equal to 1, no, more than 1, no, it should be less than 1, which we have shown there. Sedimentation volume, always an ideal suspension, it should be less than 1. And it is immiscible liquid of oil and water can be overcome by formulating an emulsion. It can be used by emulsify, formulating suspension, no, not it is a solid and liquid. The solid is dispersed in a liquid, that is suspension. And is it formulation of insufflation? Insufflation, no, you know that, injecting into the cavities of the body. And formulation of an elixir, hydroalcoholic solution, no. So that's what you have to think it over. And the next question, suppository bases. There are many bases which is used, cocoa butter, and the cocoa butter is an example and helps to insert the body cavity, and that is theobroma oil is an example. They all are oil bases. So all the above, These all can be used as a suppositories. Suppositories can be used for vagina, that is pessaries it is called. That also can be commonly used, but specially it can be told as pessaries. And cocoa butter, and even you can use theobroma also. Which one of the following advantage of the suppositories? Need to storage in low temperature is an advantage. Its cost, I don't think. Drug may be degraded by microbial. It's not an advantage. It can be given for unconscious patient. Somebody is unconscious who cannot swallow. It can be given by means of cavity inserts, like suppositories can be kept in anus or in vagina, can be used as a suppository which can be useful. And suppositories can be applied for rectal suppositories, vaginal suppositories, urethral suppositories, nasal suppositories, ear cones are also available. And in vagina it can be a pessaries. It is called as pessaries. There are ring type and sponge types are also there. A suppositories is generally intended for the use in rectum, vagina, urethra, and so it is all the above, nasal, ear, everywhere. Vaginal suppository is also called as pessaries. Remember that. It is also called as pessaries. And simple suppositories, no. Bogies, now. And none. Bogies means that liver-like things which is inserted into the cavities. That is not vaginal suppositories. Which one of the following method used for manufacturing suppositories? It can be manufactured by hand molding, which you can see the picture, by hand itself molding. Compression machine is there, molding. Pore molding is also there in the top. And all the above, it's possible to do. Which one of the following is most common used for suppository base? Cocoa butter is the most commonly used. PEG is not, 1000 is not used. PEG plus hexanol is also not used. Irritation will cause. None of the above. And when you see the 99, which one of the following method is simplest, oldest method of preparation of suppositories? Is molding by hand. Pore molding. Hand molding is the easiest one. Compression molding is also there. Hand molding is the easiest one. And 100 answer is, question is, suppositories are general evaluated by melting range test, breaking test, liquefaction test. All tests can be done because it is a solid which we have to identify melting range of temperature, breaking test, liquefaction. These all needed for identification. And you can say plastics, materials, what is its use in the formulation? We have vials, we have ampules, we have cathedrals, we have many plastic materials which is used in pharmaceutical applications. Poor conductor of heat, that's why, and it is sufficient mechanical strength, easy to transport, so we are using this plastic container. All the above is very much useful for plastic containers used in pharmaceutical formulation and preparation. Method of extraction, infusion is an extraction, decoction is also a procedure, maceration is also a procedure. All the above, an extraction can be done. This already we have discussed in the pharmacognosy also. So they may ask in pharmaceutics also, and it is also very important. Advantages of water as a solvent in extraction. Very important, no toxicity, non-toxic, non-inflammable, and suitable for various type of constituents. It is a wide range of aqueous medium. So all the above. It is an advantage of using water as a solvent. And number 4, menstruum is a drug residue which remains after extraction. You can see the picture. Everybody will say menstruum is something else. Menstruum is a solvent which is used for extracting. In a percolator, the picture you can see washed sand, filter paper, and the drug is kept. Below that cotton, glass wool is kept. In the top you are using the solvent which you are interested for extraction. So that's called menstruum. Solvent used for extraction medicinal plant is known as the menstruum. It's true. It is menstruum is a residue which remains after extraction. It's a wrong statement. It's a false. What is menstruum? Menstruum is not the drug residue. It is a solvent which is used for extraction in a percolator. In the top, in the picture it is very clearly, it is shown. It is just a question to ask you true or false. This type of questions can also be asked. So I hope today my class may be useful. Listen and try to know, and you have to answer every question with 30 seconds. Kindly do the needful. And you can just subscribe my channel. And also you can just, that will helpful when I put some new classes, immediately you will get it. And it will helpful for me also. And you can suggest, you can ask any doubts, and also other classes, other subjects also. Slowly, I will just prepare and I will do what I can. And you have to prepare yourself, listen to the class continuously, so that it will be easy for you to get trained for the exit exam. Thank you for being with me.